Jen, you want to push record? Awesome, thank you. So today I am proud to present you guys with Brenna Lanoue and Dawn. I'm going to mess up your name, Dawn. Arkinson, right? I don't even see. Okay.
Yep, that's right. She's working on parade stuff, so she won't be
Oh,
presenting.
so it's just Brenna today.
Yep.
Well, Brenna's a rock star. She can do it by herself. Brenna works in our breast cancer department, and she has been with the health board for a while now. So, are you able to share the screen, Brenna? Your screen?
I don't see any.
So if you go down to the bottom and hit share, it's like a green folder.
Oh, there it is. Okay.
Found it?
Yes, thank you.
Go ahead and begin when you're ready.
Okay. All right, you guys should be seeing the wrong slide. I don't know. There we go. All right, can you see a screen that says Demystifying Breast Cancer Screening?
No, we don't.
Okay. Do you see anything on my screen?
Just you.
Oh boy, my face all big for
I'll
everyone
be
to see.
You can see it now, Brenna.
Okay, thank you. Yes. All right, well, my name is Brenna Lanoue, and I'm with the Honor Every Woman program, also known as the Breast and Cervical Cancer Early Detection Program. We're going to be covering some issues related to breast cancer screening in honor of Breast Cancer Awareness Month. So this presentation will cover what our program is, what cancer is and what cancer screening is, the differences between screening and diagnostic mammography, what a screening MRI is, and the difference between a clinical breast exam and a breast self-exam. We'll also be talking about risk factors for breast cancer and reducing risks. And then we'll talk about our screening guidelines and then some of the things that Honor Every Woman offers. So first of all, Honor Every Woman is a breast and cervical cancer early detection program. We were funded in 2017 to increase breast and cervical cancer screening rates among American Indians and Alaska Natives in the Great Plains. We operate by using direct screening reimbursement and health systems changes or evidence-based interventions. And some of the evidence-based interventions include provider reminders, client reminder systems, reducing structural barriers, and provider assessment and feedback. I have more to say on that, but I can't seem to see my notes, so 1 second here. Currently, Honor Every Woman is working on a pilot project for direct screening in one clinic. And eventually we will expand direct screening facility by facility once our pilot is completed. We hope to reach facilities in North Dakota, South Dakota, Nebraska, and Iowa. And our region also has 17 facilities and 1 service unit. As far as evidence-based interventions, how we do that is we give out small community grants to local communities. And in our last fiscal year, we worked with 6 communities and 1 public health entity to implement some of these evidence-based interventions that are on your screen. And this year, we'll be working with 9 communities in that same public health entity. So in order to qualify for our program for the direct screening reimbursement, women must meet the following qualifications. They must be 21 to 64 years old to qualify for our cervical services, and 40 to 64 to qualify for our breast cancer screening services. They must have an income at or below 250% of the federal poverty level, be American Indian or Alaska Native, and be underinsured or uninsured. Underinsured means their insurance may not cover screening. And then, of course, Medicaid and Medicare recipients do not qualify for our program. So what is cancer? Well, cancer is the uncontrolled growth of cells in the body. This happens when cells can no longer control their life process. Old cells will not die, and instead they form new abnormal cells that can end up forming masses, what we would call a tumor. And the unrestricted growth can sometimes spread from one body part to another. That's called metastasis. And when cells perform this way, it makes it difficult for the body to function as it normally does. Cancer can occur anywhere in the body, and not all cancers are the same. Some grow slowly, some grow quickly, and this doesn't even really depend on the region. So not all breast cancers behave the same. Some can grow faster and some can grow slower. And what's important to remember is that breast cancer is a really, oh, it's not? Oh, apparently my slideshow is not moving on. So 1 second here. Try to hit a few buttons. Okay, here we go. This is what I'm talking about right now. Sorry about that, guys. So again, just to sum it up, cancer is the uncontrolled growth of cells in the body, and it can happen anywhere in our bodies. And breast cancer is the second leading cause of cancer death among American Indian, Alaska Native women in the Northern Plains region. This includes the Great Plains. We don't have specific data right now on just North Dakota, South Dakota, Nebraska, and Iowa, but the Northern Plains region does include the Great Plains. It also spans from Montana to Illinois. Understanding how this disease operates and what steps you can take to reduce your risk is it's a life-saving mission. Because overall, 1 in 8 women will be diagnosed with breast cancer in her lifetime, but there are ways to detect it early and reduce your risk from dying from this disease. And one of those ways is a cancer screening. I think my presentation's on a timer. So let me. Sorry guys, I'm gonna try to fix this real quick.
Well,
okay.
Brenna, you got it?
I think so, sorry about that.
That's fine.
So you should be seeing a screen that says, what is a cancer screening? Okay, so I didn't hear any feedback on that, so.
We see that one, Brenna.
Okay, thank you.
Yep.
I just want to make sure.
No
okay,
problem.
So a cancer screening is one way to detect cancer before the symptoms appear. Some of the things cancer screenings do are to find cancers before symptoms appear. They screen for cancers so that it's easier to treat and cure when they're found early. They've been proven to have few false negative tests and false results. And performing these tests decrease the chance of dying from cancer. And the type of test and procedure vary by the type of cancer that an individual is being screened for. Some of the things that cancer screenings don't do is they don't actually diagnose cancer. So what they do is they're meant to tell you you don't need to do a follow-up, basically. So there are 4 major types of cancer screening, at least widespread. Perhaps the most well-known is the mammogram, which is used to screen for breast cancer. Other cancer screenings include the pap test or pap smear and the HPV test to screen for cervical cancer, the colonoscopy and or the stool test to screen for colorectal cancer, and also the low-dose CT scan to screen for lung cancer. This is typically reserved for those who are at high risk, which is determined by your smoking history along with your provider. And this is not as widely used as the first 3. The first 3, mammogram, pap test, HPV, and colonoscopy and stool test are considered routine and standard practices by most physicians. And for more information on how cancer screenings are studied and become standard practice, you can check out I have a link here to the Screening and Prevention Editorial Board. I can give that to someone from our Good Health and Wellness team to get to you if you guys are interested. Just let us know. So the basics of a mammogram. Mammograms are an X-ray of the breast, and they're performed by a qualified medical professional at an FDA certified facility. It's important to ensure that the facility you are using is certified to perform mammograms under the Mammogram Quality Standards Act. And compared to other popular breast exams like the clinical breast exam and the breast self-exam, the mammogram has one major difference. It is the most widely used procedure that reduces and has been proven to reduce the rate of death from breast cancer. And anybody can do this. Anybody can go online and look up the facility where they are receiving their mammograms and check if they are following the Mammogram Quality Standards Act. So there are 2 types of mammography used for breast cancer screening and diagnosis. There screening mammography, which is an X-ray picture of the breast, and screening mammograms are used to check for breast cancer in women who have no signs or symptoms of the disease. During this procedure, a provider will place your breast on a flat plate and will flatten it and take the X-ray of your breasts in order to get an image that is readable. Screening mammograms usually involve 2 or more X-ray pictures or images of each breast. These images make it possible to find breast tissues that cannot be felt. Early detection of breast cancer with screening mammography means that treatment can be started earlier in the course of the disease, possibly before it has spread. Results from randomized clinical trials and other studies show that screening mammography can help reduce the number of deaths from breast cancer among women ages 40 to 74, especially for those over age 50. However, studies to date have not shown benefit from regular screening mammography in women under age 40. And the same procedure occurs with diagnostic mammography. However, diagnostic mammography takes longer to perform than screening mammography, and the total dose of radiation is higher because more X-ray images are needed to obtain views of the breast from several different angles. So the technologist may magnify a suspicious area to produce a detailed picture that can help the doctor make an accurate diagnosis. A diagnostic mammogram can also look at changes over time that are observed during a screening mammogram, or to view breast tissue when it is difficult to obtain a screening mammogram because of special circumstances. This also shows the uniform system that radiologists use to categorize the results from screening and diagnostic mammograms. So you can see that while the purposes of each mammogram are different, they are still all graded in the same way. And the next procedure someone may encounter on their breast cancer screening journey is a screening MRI. It's important to remember that screening MRIs are always used in conjunction with mammography. A screening MRI uses magnets and radio waves to create a picture of the inside of the breast. It is not recommended to do a screening MRI alone or for women who are of average risk. A mammogram is sufficient if you are of average risk for breast cancer. However, those with specific gene mutations that make you high risk should consider getting a screening mammogram in addition to your mammogram. And remember, if you are concerned about your lifetime risk of breast cancer being moderate to high, this means 15% lifetime risk to maybe over 20% lifetime risk. Make sure to ask your provider if a screening MRI will benefit you. And another procedure you might encounter is the breast ultrasound. The breast ultrasound uses sound waves to make a computer picture of the inside of the breast. It's mainly used to examine types of breast changes. It may be done in addition to a mammogram as a follow-up to an abnormal result, or used if you have particularly dense breast tissue. For women with dense breast tissue, a mammogram may not be able to see through some of that tissue. Also, you may need a breast ultrasound if you're pregnant, because mammography uses radiation, but the ultrasound does not. And also if you're under the age of 25. Breast ultrasound is generally not considered a cancer screening on its own, but if the above conditions are met, it may serve as one in unusual circumstances. And during this procedure, they'll place gel on the skin of your breast and use a wand-like instrument called a transducer. And that is moved over the skin. The transducer sends out sound waves and picks up the echoes as they bounce off your body tissues. The echoes are made into a picture on a computer screen, and you might feel some pressure as the transducer is moved across the breast, but it should not be painful. So most women get a clinical breast exam at their annual Well Women visit, but it's important to know that a clinical breast exam is not sufficient to check for breast cancer. You need to be getting your mammogram regularly if you are 50 to 74 years old. But some of the things that a clinical breast exam is they're done at a clinic or hospital, and they must be done by a CBE trained medical professional. Not all medical providers are trained in clinical breast exams. And it's, again, this does not reduce rates of death from breast cancer. And the next one, since it is Breast Cancer Awareness Month, you've probably seen many guides throughout your life, and especially this month, on how and when to do your own breast exam. Regular self-breast exam, or BSE, is checking your own breasts for lumps or other unusual changes. It is not specifically recommended for breast cancer screening. In clinical trials, BSE alone was not found to help reduce the number of deaths from breast cancer. And BSE should not replace a mammogram, but be used as a tool for individuals to be aware of potential changes in their body. I like to think of it as a self-awareness tool, but not a cancer screening. It's a way to be empowered about your health. The more you know about what is right and normal for you, the more equipped you'll be to ask questions of your provider and notice when things are not right. So some of the risk factors for breast cancer, and these are the risk factors you cannot change. And it's important to remember that having any of these risk factors does not mean you will get breast cancer, and having none of these doesn't mean you won't. Even some men can be diagnosed with breast cancer. According to the CDC, most women have some risk factors, but most women will not get breast cancer. Most breast cancers are diagnosed after age 50 because your risk for breast cancer increases with age. Family history is another big risk factor. So if you have a first-degree relative who's been diagnosed with breast cancer, your risk increases. And that means if you've had a mother, sister, or daughter, your risk goes up. Even having a first-degree male relative with breast cancer can raise a woman's risk. And then certain genetic mutations can increase your risk. And you can find out if you have these genetic mutations by asking for genetic testing from your provider. And always talk to your provider about any of your risk factors. Also, if you have experienced early menstruation, that means the onset of your periods occurred before 12, or you went into menopause after 55, you're exposed to hormones longer, and that can increase your risk. And then your breast density, women with dense breasts are more likely to get breast cancer. Mammograms also have a harder time seeing through the connective tissue, making detecting breast cancer harder for women with dense breasts. Also, if you had previous treatments using radiation therapy, especially before the age of 30, like for, I think, Hodgkin's lymphoma. And then if your mother took, I'm gonna say DES because I can't pronounce that. If your mother took DES during pregnancy, you were also at higher risk. And then if any of these apply to you, make sure that you talk to your medical provider about what that means for you and what your screening recommendation should be. If your risk is higher than average, you may need to consider, along with your provider, whether or not to modify the type and timing of your breast cancer screening. So here are some things women can do to reduce their risks, or things they should watch out for. So one risk factor is a lower level of physical activity. So being less active raises your risk of breast cancer. If you're overweight or obese, your risk for breast cancer increases, especially if you're overweight or obese after menopause. Hormones. Taking hormone replacement therapy for menopause over 5 years can increase your risk. And also some forms of oral contraceptives, birth control, can increase your risk. And if you have your first full-term pregnancy after the age of 30, or do not breastfeed, or have never had a full-term pregnancy, that can also increase your risk. Risk is also increased the more alcohol you consume, and smoking is a risk factor for multiple cancers. So some things you can do: maintain a healthy weight and stay active. You can limit your alcohol consumption, ideally to none. I think the recommendation is that women have no more than 1 drink per day and 2 per day for men. And then quit using commercial tobacco, and know your risk factors and talk to your doctor about them. I think this is perhaps the most important thing you can do, is to remain an active participant in your healthcare. Ask questions, keep your provider informed on how you feel and what is going on with you. And then remember that breast self-exams are a tool for self-empowerment and are a way to inform your provider about any changes. And then you don't need to find a lump to tell your provider that something's changed with your breasts. Skin changes and textures are also things to talk about with your provider. And then know your family history. Talk to your family about this disease. Knowing all of your risks is one way to get ahead and ensure that you are sticking to the correct screening schedule. So for women of average risk, the United States Preventative Services Task Force recommends screening every 2 years with mammography for women 50 to 74 years old. Women before they turn 50 should talk with their provider about what screening schedule is right for them. And this is where all those risk factors come in. So if you do have any of those risk factors and you are under the age of 50, it may be time to talk to your provider about what kind of screening is right for you. And then women 75 years and older, it's been concluded that mammography isn't beneficial when compared with its risks. So because it is Breast Cancer Awareness Month, Honor Every Woman has several events going on. We are running a Think Pink for Breast Cancer Awareness campaign, and this is going until October 25th. So we're asking our healthcare facilities in our region and our partners to take a photo and wear pink and send it to us. We are doing a photo contest for that. And we will be at the Black Hills Powwow starting Friday at 1 p.m. and Saturday until 8 or 9 p.m. So come visit us if you're in the Rapid City area. And that morning on the 12th, we'll also be in the parade. So make sure to wave at us. And then we'll be in Flandreau next week for a health fair. And then we'll be doing socks and sandwiches with Terry Rattler. She hands out socks and sandwiches to people and provides breast cancer education. And then on October 25th, we'll be doing what we call Think Pink Day, where we'll have all of our Great Plains Tribal Chairmen's Health Board employees dress up in pink. So if you have any questions about any of these events, they're all happening, I think, in the Rapid City area, and except for the Flandreau Health Fair and the socks and sandwiches, that'll be in Pine Ridge. So if you have any questions about that, I'm sure Tara or Shannon can get you my information, and I can send you some more information on all of these events. We also provide fact sheets, brochures, and posters on breast and cervical cancer. So you can get the fact sheets at our website, but anything else, just send me an email and we can send you some brochures and posters on some of these topics. And I think that's all I have.
Awesome. Thank you, Brenna. Does anybody have any questions for Brenna about cancer or breast cancer or anything else, treatment? Do we have any breast cancer survivors on the call? Anyone? Can't see everybody. All right, we will put the evaluation link in the chat box. If you guys could fill this out for us, it's a big help with us knowing that, you know, we're doing our job right. Next month's webinar is the 12th. I can't make eye contact with people. The 12th?
13th.
13th. And the topic is?
It will be Nebraska Department of Health. They will be presenting on one of their diabetes programs that they've had and talking about their resources.
Sounds awesome. All right, if you guys have any questions for anybody, if you wanted Brenna's information, you can go ahead and email any of us, and we can also add her email to our evaluation, our follow-up. And this will be available, so if you know anybody that didn't make the webinar, it will be available on our YouTube channel, and we will send out that link as well. So if that's all we have to cover, hope you guys have a happy October.
Thank you. Thank you, Brenna. Great job.
Yes, thank you guys.
Thank you.